Hi everyone, welcome to ResearchMD.com. My name is Dr. Pramil. I work as a Chief Medical Officer and Associate Professor of Medicine in one of the large medical schools. We're going to continue our lectures about the herbal medications. Again, I wanted to make sure, the whole purpose of this talk is not to put the herbal medications down. Herbal medicine have a lot of potentials, a lot of good usage. You can use it for to treat a lot of conditions. But you also need to understand, just like any other drug, it can develop complications. Every person I talked to, they said, yeah, it's a herbal medicine, it's come from the plant. I'm not worried about any complication, but that is not true, my friend. So we did some literature search, we find out what the complications, and we're going to teach you every complications known out there, okay? So let's start with our presentation today. It's about clove oil or clove. Where does it produce? Mainly in the Asian countries like India, Indonesia, and those are the places this has been grown. And the good side of it's anti-inflammatory, anti-infection, antiviral. Those are the good side. Now, we're going to be the bad guy in looking at the bad side of this medicine, okay? That's what we're going to do. Now, when we look at it, how does people use clove? They use it as an oil, and they put it on the joint, on the skin. Usually, for toothache, a lot of people kind of use this. And people also smoke clove cigarettes. A lot of usage of clove cigarettes, okay? So, what is the main component is mainly eugenol, and it also has a polyphenolic acid. Those are the main components. It's good to know what components are. Mainly the complications is because of this compound called eugenol. Okay. Now, next thing what we need to do was we went and did a lot of literature search. Again, we wanted to make sure to tell you all our presentation purely based on science. And the first thing we looked at the study published in the Turkey Journal of Pharmaceutical Sciences, and let's see what kind of complications they found. Okay, the main complications they found, you got a lot of allergic reaction because people were putting that in the mouth and on the skin, and it can develop redness, itching, necrosis, and it can cause a lot of gingivitis, inflammation of the gingiva in your mouth, and it was causing a lot of, we can say kind of relation because of the allergic reaction. That's what they found, okay? Next thing, we found this case report about a 27-year-old who took as a herbal tooth powder for, I don't know why he took it. Then what happened was he developed redness, swelling in the gingiva, bleeding was noted. So they call, plasma cell gingivitis was caused by clove herbal powder in this case, okay? So let's look at the next case report. Is about an 80-year-old. He had a dental procedure of a pulpectomy, and they gave some clove oil, and then this poor kid, you can see the picture clearly, he developed a lot of allergic reaction, even not only in the mouth area, all over the body he developed. Okay, let's look at the next case report. It was about a 2-year-old kid who ingested clove oil, and then he had many complications. This is probably one of the serious reported effect of clove oil. This patient eventually in a coma. He had seizure. His kidney went down. He got hypoglycemia, lactic acidosis. He got liver failure, and it's also in this patient, poor guy, had a fluid built into the lungs. We call the pulmonary edema. Okay. Now, the next presentation is about looking at the hepatotoxicity. That means liver toxicity. They found a lot of damage when people take into the liver. And let's look at the next case. You got a 2-year-old. Again, he ingested, or he took the clove oil, went into liver failure, and he got diffused. We call DIC. All the blood products start breaking down. Massive reaction in the body. That's what happened. Okay. And the next case report was about a 32-year-old patient. This is kind of unusual. What they did is they take this clove oil, injected into the injected IV intravenously, and then he went into massive pulmonary edema. That means lungs start failing, fluids start building it up. Okay. Next case is about the clove. Now I look at the clove cigarette. People are smoking as a clove cigarette. A lot of respiratory complications, lung issues, pneumonitis. They start having fever, cough. A lot of symptoms kind of related to the pneumonia. Next case report is about a 7-month-old patient who ingested the clove oil. He got he got CNS depression, respiratory depression. He got urinary abnormalities. Also developed metabolic complications like metabolic acidosis was developed. And the next case report is about a 29-year-old patient who was smoking the clove cigarette in the high altitude. Again, he developed in the pulmonary edema, a lot of, again, fluid buildup in the lung fields. So overall, when we talk about clove oil, it definitely have a lot of complications we need to worry about. Mainly, can it cause allergic reaction, hypersensitivity reaction. The serious complication, you can have like seizure, or renal failure, coma you can develop. If you smoke the clove cigarette, be careful. It can cause pneumonia-like symptoms. It can cause fluid buildup in the lungs, and eventually can have respiratory failure. Thank you so much for watching our presentation. We'll be back with another presentation soon. God bless.